Former President Joe Biden faces a new challenge. He has been diagnosed with prostate cancer. This diagnosis adds another chapter to his long and storied life. It is a reminder of the fragility of life, and it highlights the importance of medical advancements in the fight against cancer. Biden's diagnosis has sent ripples through the nation and the world. It serves as a stark reminder that cancer can afflict anyone. No one is immune, regardless of their age, status, or power. This diagnosis is not Biden's first encounter with cancer. It marks the continuation of a personal battle against this formidable foe. Biden's journey will undoubtedly inspire countless others. He will face this challenge with the same resilience and determination that has defined his career. Prostate cancer is a formidable adversary. It is a disease that affects the prostate gland, a small but vital part of the male reproductive system. Understanding this enemy is crucial in the fight against it. It is the most common cancer in men in the United States, affecting 1 in 9 men during their lifetime. This high prevalence makes it a significant public health concern. It is the second leading cause of cancer death in men, following lung cancer. The mortality rate underscores the seriousness of this disease and the need for early detection and effective treatment. The prostate is a small gland, about the size of a walnut, that plays a crucial role in male fertility. It is located below the bladder and in front of the rectum, surrounding the urethra, the tube through which urine and semen pass. The prostate produces fluid that nourishes and protects sperm, making it essential for reproduction. This fluid is a key component of semen. Prostate cancer occurs when cells in the prostate grow uncontrollably. These abnormal cells can form tumors and disrupt the normal function of the gland. These cancerous cells can invade nearby tissues, including the bladder and rectum, causing further complications. In later stages, they can spread to other parts of the body, such as the bones and lymph nodes, a process known as metastasis. This makes the disease more difficult to treat. The symptoms of prostate cancer often appear in the later stages, making early detection challenging. These symptoms can include difficulty urinating, blood in the urine, and bone pain. Other symptoms may include erectile dysfunction and discomfort in the pelvic area. Prostate cancer is a complex disease with many variables. Research is ongoing to better understand its mechanisms and to develop more effective treatments. There are many factors that can influence its development and progression, including genetic predispositions, environmental exposures, and lifestyle choices. These factors include age, genetics, and lifestyle. Older men, those with a family history of prostate cancer, and individuals with certain dietary habits are at higher risk. Regular screenings and a healthy lifestyle can help in early detection and prevention. Doctors use a tool called the GleasonScore to grade the aggressiveness of prostate cancer. This scoring system is crucial in understanding how severe the cancer is and how quickly it might spread. By analyzing the cancer cells, doctors can make informed decisions about the best treatment options for their patients. This score helps determine the best course of treatment. It guides doctors in choosing between options like surgery, radiation, or hormone therapy, ensuring that each patient receives personalized care tailored to their specific condition. The Gleason score ranges from 2 to 10. These numbers are derived from the microscopic appearance of the cancer cells, with lower numbers indicating cells that look more like normal cells, and higher numbers indicating cells that look more abnormal. A lower score indicates a less aggressive cancer. For instance, a score of 2 to 4 suggests that the cancer is likely to grow slowly and may not need immediate treatment. A higher score indicates a more aggressive cancer that is more likely to spread. Scores of 8 to 10 are particularly concerning, as they suggest a high likelihood of rapid growth and metastasis. A Gleason score of 9, like the one President Biden received, is considered high. This means the cancer cells are very different from normal cells and are likely to grow and spread quickly. It means the cancer is aggressive and requires prompt and comprehensive treatment. Doctors may recommend a combination of therapies to tackle the cancer from multiple angles. The Gleason score is determined by examining the appearance of the cancer cells under a microscope. Pathologists look at the patterns formed by the cells and assign a score based on how much the cancer cells differ from normal prostate cells. It assesses how different the cancer cells look from normal prostate cells. The more abnormal the cells appear, the higher the Gleason score, indicating a more aggressive cancer. While a Gleason score of 9 is concerning, it's important to remember that it is not a death sentence. With modern medical advancements, even high-grade prostate cancer can be managed effectively. Advances in treatment options offer hope for patients with even the most aggressive forms of prostate cancer. From targeted therapies to immunotherapy, the landscape of cancer treatment is continually evolving, providing new avenues for hope and recovery. President Biden's recent diagnosis revealed an aggressive form of prostate cancer. The cancer was discovered during a routine physical examination. A small nodule was detected, prompting further investigation. Subsequent tests, including biopsies, confirmed the presence of prostate cancer. The diagnosis of metastasis to the bones is significant. It means the cancer has spread beyond the prostate gland. This spread makes the disease more challenging to treat. Metastasis occurs when cancer cells break away from the primary tumor. They travel through the bloodstream or lymphatic system. The bones are a common site of metastasis for prostate cancer. This spread can cause significant pain and weaken the bones, increasing the risk of fractures. Section 5. A History with Cancer. President Biden's battle with cancer is not new. He has faced this formidable foe before. His past experiences with cancer have shaped his perspective and fueled his commitment to fighting the disease. In 2023, President Biden underwent surgery to remove a cancerous lesion from his chest. The lesion was detected early, and the surgery was successful. Prior to his presidency, Biden had several non-melanoma skin cancers removed. These skin cancers were treated with Mohs surgery, a highly effective technique. These past encounters with cancer have undoubtedly given President Biden a deep understanding of the challenges faced by cancer patients and their families. They have also strengthened his resolve to advance cancer research and improve treatments. Section 6. Weapons in the Arsenal Treatment Options. President Biden and his medical team are currently reviewing treatment options for his prostate cancer. There are several approaches available, each with its own benefits and risks. Hormone therapy is often used to treat prostate cancer. This therapy works by blocking the production of testosterone, which can fuel the growth of prostate cancer cells. Chemotherapy is another treatment option. It uses drugs to kill cancer cells. Chemotherapy can be administered intravenously or orally. Radiation therapy uses high-energy rays to target and destroy cancer cells. It can be delivered externally or internally. The choice of treatment depends on several factors. These include the stage and grade of the cancer, the patient's overall health, and their personal preferences. Section 7. A Chorus of Support. News of President Biden's diagnosis has been met with an outpouring of support from across the political spectrum. Leaders from both sides of the aisle have expressed their well wishes and offered their prayers. Former President Donald Trump, Vice President Kamala Harris, and former President Barack Obama are among the many who have publicly conveyed their support. These expressions of solidarity highlight the unifying nature of fighting cancer. The public has also rallied around President Biden, offering messages of encouragement and hope. This outpouring of support underscores the deep respect and admiration he commands. Section 8. A Moonshot Against Cancer. President Biden's personal experience with cancer has fueled his unwavering commitment to advancing cancer research. His signature initiative, the Cancer Moonshot, aims to accelerate progress in the fight against cancer. The Cancer Moonshot was first announced during the Obama administration. It received renewed vigor under President Biden's leadership. The initiative focuses on several key areas. These include early detection, prevention, developing new treatments, and improving the lives of cancer survivors. The Cancer Moonshot has already made significant strides. It has funded promising research projects, expanded access to cancer screenings, and fostered collaboration among researchers. Section 9. A Father's Legacy. President Biden's dedication to fighting cancer is deeply personal. His commitment goes beyond policy and politics. It is rooted in a profound personal tragedy that has shaped his mission. He lost his son Beau to brain cancer in 2015. Beau was not just a son but a close confidant and a source of immense pride for Biden. Beau's battle with cancer left an indelible mark on President Biden, shaping his worldview and priorities. The pain of losing Beau is something that Biden carries with him every day, influencing his decisions and actions. Beau's legacy lives on through President Biden's unwavering commitment to finding a cure for cancer. This commitment is evident in his relentless efforts to fund cancer research and support those affected by the disease. He often speaks about Beau's courage and his determination to live a full life despite his illness. These stories serve as a source of inspiration and a call to action for many. President Biden's fight against cancer is both personal and national. He has made it a cornerstone of his administration, pushing for comprehensive healthcare reforms and increased funding for cancer research. It is a fight for his own health and the health of millions of Americans. His efforts aim to ensure that no family has to endure the pain and loss that his family has experienced. His unwavering commitment to this fight, fueled by his personal loss and driven by his empathy for others, will leave a lasting legacy on the nation and the world. Through his actions, President Biden hopes to bring about a future where cancer is no longer a death sentence, but a disease that can be managed and ultimately cured.